Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the show that's dedicated to your health, welfare, longevity, and well-being. Tonight's program is entitled Carpal Tunnel Syndrome. The reason, if you watch this show tonight, you should be able to prevent and cure 95% of all of the cases of carpal tunnel syndrome. So if either you or anyone you know suffers from this disorder, don't change the channel. Carpal tunnel syndrome is a problem that deals with compression of both the nerve and or blood supply that goes from the wrist into the hand. This is an extremely common malady nowadays because a lot of people are using the computer more, they're sitting, they're holding postures that allow for this compression to occur at an extrapolated rate than it ever happened before in history. The symptoms that a patient may experience with this would be numbness of either one or all of the fingers, tingling, swelling, pain, lack of sensation, a change in normal sensation, either hot or cold, and discoloration in severe cases. Most cases of carpal tunnel syndrome, in fact only 5%, ever need to have surgical intervention performed. And in those cases, it is due to severe swelling and discoloration upon which the person's hand is purple. So those are very few cases. Carpal tunnel syndrome can come on gradually over a long period of time. Carpal tunnel syndrome can also come on very acutely, meaning very rapidly, very fresh. A person could be playing golf. They could get a divot into when they're taking a shot, take a big hunk of grass out of the ground, and start this whole process of neurovascular compression into this area. Tonight, we're going to show you a lot of self-treatment for you to do, of when you're going to need to go and see a doctor to help you with this condition. And to start with, we're going to start with some basic anatomy so that you have a background upon which we can build this further discussion as we demonstrate our treatment. Now, when we're talking about the wrist and neurovascular compression, this is the wrist on our chart. And going through your wrist, you have blood supply and nerve supply and tendons and muscular junctions and soft tissue that leads and helps to guide and stabilize the movements of the hand. There is a large ligamentous band that is here. It's called the flexor retinaculum. That is this portion right here. That is where usually we get, and most of the problem is caused. Tension, tightness, and compression, dealing with abnormal tightness on there is what gradually brings the symptoms on. With carpal tunnel syndrome, sometimes the more a person does the computer or the more they do this micro-trauma, meaning gradual, repeated fine use of it that causes the agitation over a long period of time, it may be bothered as you use it more during the course of the day. Sometimes it's bothered only after you do the activity, because what happens is that when you're moving all day long, your bones and muscles and ligaments have a tendency of staying loose. It's when you stop doing it that gradually the soft tissue of your body starts to contract, and then you start to experience the symptoms. A lot of times people are bothered with it more at night. They want to sleep and they can't sleep, and gradually it comes on and prevents them from sleeping. A lot of the time pregnant women will get carpal tunnel syndrome. And the reason for that is that as their body gets bigger and as they get a lot more swelling and fluid accumulation, everything is getting bigger in their body, but this ligamentous band isn't. So we have a much greater volume going through the same area. So what happens is that when you're pregnant, there's a greater tendency towards carpal tunnel syndrome. The other side of the coin, too, is that sometimes women will get carpal tunnel syndrome because they don't have enough relaxin. It's a hormone that's gradually expressed as they approach delivery, and when there's not enough of it, it doesn't allow for the ligaments in the body to gradually relax and be able to get gangly so that a woman could accommodate childbirth. So what we have is we have the neural elements going through here. We have the blood supply and the nerves that control all of the movements of the finger. Some people will come in and they'll say, "Doctor, it's very important to take an appropriate history when you're doing carpal tunnel syndrome, because I found that a lot of doctors will misdiagnose the underlying cause of the problem. Usually, if it's vascular compression, all of the fingers are going to have all of the symptoms. Because, and why? Because the reason is that the blood supply that goes through your hand is going in an arc. It's going in a circle. So normally we're not having one or two fingers affected. You're having the whole hand affected. So that's more of a clear indication of a vascular compression problem. If a person says, "Doctor, I get these symptoms and it's just these two fingers, or it's just these two fingers, or it's this and these," that is more indicative of a particular nerve root compression. And that nerve could either be compressed at the wrist, at the elbow, or up into the neck that causes a radiating pain and causes these symptoms. You do not always have to have neck pain to have these radiating nerve symptoms. You could have just this, and it could still be caused up into the neck. So anytime a person's having hand symptoms, there has to be proper evaluation up into the neck region, along the course of the arm, the wrist, and the blood and nerve supply to the involved areas. As we refer back to our chart of the nervous system, what we find is that different nerves supply different sensitivity regions to different portions of your fingers. So for this particular area, it would be your 8th cervical nerve that would be causing, if we had dysfunction here, you could get compression up into the neck. And usually those people that have that will have pain right up into here. They will have these symptoms, and they will the pain will be reduced up into here. And the person, it is more than likely the neck problem causing your hand problem if when you're sleeping and you move your hand up and you go like this and change position, if your symptoms go away, then it's more than likely that your problem's in the neck and not into your hand itself. When you can't shake it out of your hand no matter what you do, it's more than likely in the hand itself. What we do, sometimes people at night, is that when the hand is held in this position, it allows for the most blood and nerve supply. This is the natural hand position, just like this. That's the way in which your hand is normally held. It's not flat like this. We hold like this. When it's like that, we have the largest opening for the tunnel. So at night, frequently we'll give people what's called a night guard. That's a special support that they'll use in here that will hold their hand and allow for the largest optimal tunnel for all that blood and nerve supply to come through. So what we're looking at here is that we have a circumstance where nerve compression up into here. So if you had neck problems and mid-spinal problems, this could contribute towards the pain that you're getting down into the arm. It's called brachial syndrome or brachial radiculopathy. It used to be, years ago, all I would have to do was differentially diagnose. That means find out the causative element of what's causing that problem, and that condition would heal itself because we were giving it the appropriate treatment. But what we find now, due to bad ergonomics at work, the person sitting at the computer for hours and hours on end, frequently they will be getting not only carpal tunnel syndrome, but they'll be getting tendinitis because the pain will be coming up into here. They could get tennis elbow, lateral epicondylitis, and they could be getting this at the same time. So frequently, people that have these symptoms need some form of home care or intervention, on numerous zones. So it's very important to diagnose these elements. What we see here is that nerve compression can occur in these regions due to spinal malalignment, causing radiating pain into there. Sometimes arthritic involvement of the joints. If a person has a lot of osteoarthritis, what can happen is that creates an inflammatory response in and around the wrist, thus making it so that the swelling is increasing the pressure. The ligaments aren't tight, but there's so much swelling around the soft tissue that it is like a hose expanding just due to more fluid intake. If you want to decrease the likelihood of carpal tunnel syndrome, you better start losing weight, because you're going to be doctoring from here to kingdom come unless you lose the weight. If you're overweight and you have carpal tunnel syndrome, you better get self-empowered and lose the weight. The other thing is that you have to go on a somewhat modified sodium diet, low sodium diet. The reason for that is sodium increases water retention, and that water retention then increases the nature of the symptoms. Women frequently have carpal tunnel syndrome at a greater degree than men do, and the reason for that is because of the way that their hormones are. Their hormones create a lot more water retention in the cyclic nature of the way that their feminine cycle is. This chart demonstrates to us some of the muscular components associated with the condition. And what we find, the most frequent thing is right on the lateral aspect of the elbow. This region into here is very common. This needs to be treated along with your wrist if you have pain up into here. Now keep in mind, if it's just carpal tunnel syndrome that a person has, they're just having the symptoms into their hands. So if you go to the doctor and he tells you, oh, you've got carpal tunnel syndrome, you shouldn't be having symptoms up into here. If you do, it's because you have carpal tunnel syndrome, maybe, and maybe something in addition to that. Tendinitis, frequent, pronator syndrome, supinator syndrome, all of these things have to be diagnosed correctly so that you're getting the right take on what you should do. We're going to explore different treatment modes and self-treatment tonight. But one thing I wanted to go over with you is the use of Chinese acupuncture and electroacupuncture in the treatment of carpal tunnel syndrome, which we'll be demonstrating tonight. And there's acupuncture points in and around the wrist that will cause that ligamentous band to relax and stretch and get loose. And once that happens, the symptoms reduce and go away.
It's my birthday. Oh, it's so pretty. Oh, I told you, don't be bringing that weak stuff in here. Yeah. Who's the man? Who's the man?
Exercised lately?
Introducing the all-new Enclave. It's a minivan to the max, with features like remote control sliding rear doors, 150 cable channels, a full sky view roof, temperature-controlled cup holders, and the 6-point navigation system. It's the minivan for families on the go.
Young, who got some good minutes in the first half, hits the jumper. Tiffany Young, a junior from Hillsboro, Alabama, has 4. Young, 17, Footer's got it. And Tiffany Young with a sensational performance.
With us today is Carol Deneen, a friend, a long-term patient of mine, and her family have been supporters of mine for a long time. And Carol has decided to come in and join us today so that I can demonstrate some things on her. We're going to go through the very quick analysis, and we're going to pick up the pace a little bit so that we can condense a lot of information in a short period of time. Remember, a person comes in with the symptoms. They're going to fill out a history form. Then we're going to go into the office. We're going to do a history of the onset of their condition. What are their symptoms, when it bothers them, how long it's been bothering them, the severity of them, and a whole history. From there, we're going to go into the exam room. They're going to show me where their pain and symptoms are, when it comes on, and whether there's any mechanical component to the problem, meaning when I hold my hand this way, it bothers me more. Usually, the first thing I'm going to do when a person's sitting there is I'm going to come and I'm going to have them hold up their hands like this. And I'm just going to sit there and talk to them for a minute while their hands are held up like that. Hello, Carol. And what's happened in true carpal tunnel syndrome, when we go like this, you're taking that tunnel and you're compressing it more. So it should bring the symptoms on in true cases of carpal tunnel syndrome. Doesn't mean you don't have it if it doesn't do it, but it means it's a more mild case. The next thing I'm going to do is that I'm going to come and I'm going to press both sides of the hands like this. And I'm going to ask the patient to make a fist. Let it go. Let your fist go. See how it's white? Because I cut off the blood supply to her hand. I go like this. See how her hand turns red again? Make a fist again. Let go. Then I let go on this side. See how it turns red again? That indicates that both of the arteries that are making that loop into the hand are intact. The next thing we're going to do is that we're going to check the person's reflexes. We're going to check their biceps reflex, which is good. We're going to check the triceps reflex and the forearm reflex. This is going to help give us an indication of whether that problem is potentially being caused up into the neck region. The other thing that we're going to do is that we're going to do a pinwheel sensitivity test. Now, different nerves control different areas of the sensitivity to the skin. So what we want to do is a comparative test using a pinwheel study between one side and the other. Does this feel the same? And how about here? And how about here? Okay, so normally in cases of skin deviation or differences, it's either going to be really, really sharp if the nerves going into that area are really, really agitated. The next thing I'm going to do is that we're going to have the patient come, and they're going to hold these two fingers together like this, and I'm going to ask you not to pull them apart. Don't let me pull them apart. Usually in cases of carpal tunnel syndrome, that motion in there makes it so that it's very easy to pull those fingers apart. And then you could compare the other side. The other thing is to come like this, make a little cone. Bend like this here. I'm going to pull towards me. Don't let me do it. Right, like this? Good. She's got good strength into there. Let this rock down. I'm going to come up like this. Don't let me do it. This is a test to check on the muscular components in the involved region. The next thing we're going to do is that we're going to use a Doppler. This is a transistorized instrument that gives a very sensitive readout that allows for me to hear and rate and measure the blood flow going through the arteries. So what I would do is I put it on. Now we've got those two major arteries going into there. I'm going to check the blood flow coming into this side. I'm going to check the blood flow going into this side. And then I'm going to check the blood flow on the opposite side of the flexor retinaculum. So I can check the blood flow going in. I can check the blood flow going out to see whether I can see or get a temperature differential. So, I mean, a blood flow differential. If I find that the blood flow is the weakness or is a problem, or I suspect further that there is a problem with that, the next step that we would be doing is that we're going to use an instrument over here called a vascularizer. And Carol, just move over just a scunch. This is a machine that will record and measure the actual blood flow so that we can get a quantitative analysis of whether that blood flow component is a part of the problem. This instrument will also allow us during the course of treatment to know whether the person's getting better from the nature of the treatment. We also can measure the temperature of the fingertips, and the difference in the temperature of the fingertips will give us an indication of whether there is a blood flow problem, such as atherosclerosis or something like that, peripheral neuritis, or whether it's a nerve problem in nature. The other thing we're going to do is that we're going to check into the neck. We're going to check the ranges of motion into the neck on the patient, see how her movement is going. We're going to apply pressure down. This is called the foraminal occlusion test. If she's got a pinched nerve in the neck, it's going to cause a radiate or reproduce the radiating pain into there. We're going to see that if we separate like this, if we pull like this, is that going to traction the nerve? Does that create the radiating pain? That may be a component of the condition. Sometimes we have to take a picture, an X-ray picture of the neck. Also, there's times where we may take X-rays of either the wrist or the elbow. If there's an arthritic history in the family, the person gets a lot of swelling into there because arthritis may influence the rate of recovery of the patient. Something that I recommend that people take, because it's a passive thing that they can do, and it's very reasonable in cost, is to take some chondroitin sulfate. It is a ground-up ligament from a cow, and basically the enzymes in there have a healing effect, an anti-inflammatory effect on soft tissue. I recommend the use of chondroitin sulfate coupled with horsetail, which is a herb that's a calcium regulator in the body. So this is something that you can get at a health food store. You can start today if these symptoms bother you. It may help or cure the condition in and of itself. The other nutrient to try is by taking a product called MSM. It's another enzyme, a naturally occurring enzyme, and if you take it, it has a natural anti-inflammatory effect. You can't go take an Advil and Tylenol forever for this condition. You have to get proactive about treating it. There are times where we'll do ultrasonic therapy to release and relax into the wrist, but we don't find that in the more severe cases that the ultrasonic therapy seems to make any difference. So what we do is we utilize infratronic therapy. This is a treatment by which we use a radio wave signal into that ligament structure, and what it does is it softens the tissue. It softens the ligamentous contracture. It makes it so that the tendons become uninflamed. It makes it so that we have more room in there, and the patient can, move and takes the pressure off there. Of course, you have to change the workstation at your work and the ergonomic environment that is bad to begin with. Because if we can help you and you can get better from that, but unless you change the environment, it's going to come back. The other thing that we're going to do is that we're going to we use what's called a JMAR. This is a instrument that will measure the grip strength, and that will frequently give us an indication of the differentiation between one side and another as we help to make the patient better. Another form of treatment that we do is we may use electrostimulation into the involved area to loosen these areas, and chiropractically we may do adjustments or manipulation of the hand bones, neck, and or shoulder. And one instrument that we use, this is a pneumatic spring device that is called an activator. And what we can do is we can actually manipulate some of the fine bones carpal bones within the hands to push and make room if these bones are not moving independently. Because sometimes what happens is that there's small bones in there and they get jammed up. And when they get jammed up, it creates an inflammatory response. So what we do is we utilize this instrument, put the bones into their normal position that allows for normal biofunctions, things start to move again, and the whole problem is eradicated very quickly. What we're going to demonstrate next is we're going to demonstrate acupuncture and electroacupuncture for carpal tunnel syndrome. All of the needles that we're using here are single-use disposable sterile needles. The numbers of treatments on average that it takes to treat carpal tunnel syndrome could be as little as 3 and as many as 8, with the average being 6. The treatment is rendered either once a week or twice a week for the first 2 weeks, and then once a week till the condition resolves. Sometimes patients receive almost immediate response, especially if they follow through with the additional home care. The needles themselves have an inherently relaxing area on the body. What it does is it causes the ligaments and all of the soft tissue to relax. It causes a natural anti-inflammatory effect in the involved region. It causes a massive in with the good and out with the bad. We'll start with the treatment like this. Now, this treatment may vary from individual to individual. There's certain points within acupuncture for carpal tunnel syndrome that, regardless of the person that comes in for it, those points must be needled because time has proven them to be very, very effective. After that, it's the interaction of the doctor to find out where these additional spots to needle or to influence to benefit the condition would be. We have one more needle to stick in, and then we're going to do overlay electroacupuncture over this condition. We've applied the needles in. The needles are going to be in from a half an hour to 40 minutes. I have treated this successfully hundreds of times, and people come in and they say, well, geez, can't you make the treatment any shorter? The answer is no, not unless you want to come for more visits. The next thing that we're going to do is that we're going to take the electroacupuncture instrument. Now, electroacupuncture isn't always necessary for the treatment of all carpal tunnel syndrome. However, I've found it to be a helpful component, especially in more severe or resistant cases. Because that flexor retinaculum, that big old ligament that we want to relax and soften, is the key towards effective treatment of carpal tunnel syndrome, we always want to influence that ligament to the greatest degree. So that's why we torque it up with the electroacupuncture. Carol, you tell me when you feel that, which you will in just a sec. Pretty strong, right? Okay. And it feels like a sharp tingling, right? Okay. What I've done is I've applied an that retinaculum, that band, that ligamentous band. And what we're doing is mechanically we're softening it. That's much different from applying stim to the outside of the body. What's happening is that I'm bringing that current in right to the level at which I've needled. And I've brought that needle right into the level at which we need to treat. So it makes for very, very effective treatment regionally. Above and beyond the points that we know are going to affect the condition, what we also use is something called a point locator. Because acupuncture points are points of lowered electrical resistance, we can measure where these abnormalities may exist throughout the course of the wrist. So what we're going to do, we would start this actually prior to the needling process itself to give us additional information, but I'm trying to jam as much as I can into this show. Now what we're going to do is that the instrument itself will start to pick up on points that would be adjunctively needled. This can also be utilized for treatment itself because we can do external stimulation. But in more severe cases, and people want the most effective treatment when they come and see me, acupuncture and needle acupuncture is the best. As we demonstrated on our show before, we did the laser acupuncture, which the laser that I have at home is about, at the office, is about 100 times more powerful than this laser that's used as a pointer laser. But for patients that come in that have bad carpal tunnel syndrome, I have them purchase one of these lasers because the points that I needle here, I will also have the patient stimulate these points at home using a laser, using a regular pen light laser. Once I figure out where those areas are, I can make it so that we cut down on not only the numbers of treatments involved and the frequency, but the patient's going to get results quicker, and they're also empowered by helping themselves. Now, the work that's been done and the studies that have been done are that you can get information on this from the American Association for Acupuncture and Oriental Medicine. It is their website is directly on the internet, and there is a long-term study done by an acupuncturist woman named Margaret Nazer, using laser acupuncture and pen lasers for home therapy for treatment of carpal tunnel syndrome. So sometimes it's not even a matter of coming to see me. It's if you got the nail on the head and you got the right diagnosis. So a lot of times home therapy itself can be the key. If not, we'll be there for you if it's a resistant problem. For Natural Healthcare Alternatives, I'm Dr. James R. Golding, and thank you for watching.